Hey guys, welcome to my channel. I know I haven't made videos in a very long time just because of extremes of engagement with my profession, and I also make podcasts for my home country, Kashmir, and I've been quite busy with that as well. The reason I made this video is because one of our listeners asked me this in question, and I thought that it needs to be answered. I'm going to try my best to answer this question even in my mother tongue of Kashmiri, but because there's a lot of medical terms involved, so that's why I thought I'm going to make a video in English. The person who also asked this question seems to be a physician herself. She writes this question in regards to one of her relatives. It seems like this relative female of hers has been diagnosed with cancer of ovaries. Now, ovarian cancer is actually not that uncommon, and there are different kinds of ovarian cancer. She writes down that this relative of hers, that she was diagnosed, and fortunately she received 3 rounds of chemotherapy, and apparently physically seems to be doing well and responding well to the treatment. Unfortunately, this woman has developed what seem like mental status changes. They're constituted of excessive worrying about her physical health, increasing paranoia, becoming increasingly suspicious of her husband. This listener writes that even if her husband dyes his hair, she probably thinks that he's having an affair and that he's going to leave her and is going to marry again. She's also become very anxious, and she is refusing to get out of the house. She has become irritable and angry, and it has become very difficult for other family members to live in this house. She also mentions that her mental status changes is affecting her overall physical recovery from this cancer. Remember, psychiatric or mental status changes in various forms of cancer are very common, even though in this day and age, most of the cancers are very treatable and people do not die from cancers anymore. However, there is stigma even to the word cancer. I recall that about a decade ago, if anyone was diagnosed with cancer, it meant the end of their life, basically a death sentence. However, that's no longer the case. Many cancers, in fact, most of the cancers are now treatable. But, it takes us centuries to change our mindset. So there could be many things that could be going on with this woman. It's quite possible that she may be going through enormous stress, and she may have developed an episode of anxiety and depression, which is not uncommon. I used to work in a consultation liaison psychiatry in a very close by hospital, and I would often get called by oncologists to do psychiatric consultation for people who would develop cancer, again, because of this acute stress associated with the cancer. And many people would develop depression, anxiety. Some of them would stop eating. Some of them would even stop going for their treatments. So that's why I understand the stress and the grief and the pain associated with being diagnosed with this condition. So back to this woman, there could be several things going on, and it's very crucial that we address everything. First and foremost, this change in her mental status is not a purposeful condition. She is not doing it to gain attention. She is not doing it to create chaos. She's not doing it just because, she wants to disrupt the household. That's not the case. This woman needs extreme levels of empathy and understanding. It's very important for the family members to be very empathetic towards her, respect her boundaries, provide support, and also get support for themselves. If they feel very overwhelmed by her, it's important that the family members get educated. They should talk to her oncologist, talk to her doctor, and ask about, what can they do? How can they support her? So there are several things that can be causing mental status changes in people who have been diagnosed with cancer. The most common cause is what we call acute mental status changes, also known as delirium. Delirium it's more like a medical medical psychiatric condition which develops of either side effects of medication, side effects of chemotherapy, or just acute stress. Cognition can get affected, their memory can get affected, short-term memory. They can become very moody, very angry, very irritable, sometimes can get very agitated. They might even forget the names of the people who they've been living with, or they can also sometimes get increasingly paranoid or become psychotic. They may start hearing voices or seeing things which are not there. They can also become delusional. Delusional meaning they develop some form of a fixed belief or a fixed mindset that someone is trying to plot against them. For example, as you mentioned in this case, that she believes that her husband is going to have an affair, or that her husband will leave her and he's going to marry again. So this is some sort of a delusion. So one thing you want to do if there is a possible delirium is that you don't want to take it personally, and you simply do not want to argue with her. Try to reassure her and tell her that, hey, you know what, don't worry, I'm not going to have an affair. This is all a creation of your mind. That's something you just don't want to do. In case of a delirium, we usually go with a person's delusions. For example, you can ask her, tell me a little more about it. This must be very confusing to you. I'm sorry that you're feeling like this. What can I do to reassure you? And just kind of keep on repeating that I love you. Now remember, delirium is a medical emergency. If this is a delirium, then you have to take her to an emergency room, or also contact her doctor, contact her oncologist. Sometimes delirium can last as short as 24 hours to even 72 hours, or some deliriums can even last for a month or even weeks or even more than a month. If there is a delirium, it's critical and so important that she undergoes a psychiatric evaluation. In cases of delirium, a psychiatrist usually will put them on a very low dose of antipsychotic, but this is something you cannot do on your own. This is usually done by a professional, by an expert, by a specialist. The second common reason is brain metastasis. There are many cancers in which if a person shows acute mental status changes, paranoia, increased anxiety, one might think that if there's possibly a metastatic lesion to the brain. However, adenocarcinoma is such a cancer where brain mets are very infrequent. There are some other kinds of cancers of ovaries where the cancer might metastasize to the brain, but adenocarcinoma, again, very rare. But that all needs to be ruled out by an oncologist or by a neurologist. Okay, number third, because in this kind of an ovarian cancer, patients are usually prescribed steroids or even or chemotherapy, and you mentioned in this case that she's already gotten 3 rounds of chemotherapy, so there is a possibility that this could be a form of a medication-induced psychosis or a steroid-induced psychosis. So if it is a steroid-induced psychosis, again, that needs to be addressed by the oncologist, by her doctor. It all depends on the risks and the benefits. If they need steroid, then they're put on a low-dose antipsychotic. They're just watched and they're monitored. They're closely followed up. And usually after the treatment is over, then they come back again to their baseline. If indeed it is a steroid-induced mood disorder or a steroid-induced psychosis, the symptoms are again mood swings, increased anxiety, paranoia, hallucinations, delusions. In severe cases, a person can become manic, wherein they won't sleep, they become grandiose, they are delusional, they become highly agitated, and again, that becomes a medical emergency, in case of which this person needs to be moved to an emergency room ASAP. The third cause could be some form of an autoimmune inflammation. Again, although it's very rare in adenocarcinoma, but there are some other kinds of cancers of the ovaries wherein a person develops some form of an immune response to the cancer. And as a result, they can develop inflammation in various areas of the body, including the brain. We call this condition as a paraneoplastic encephalitis. Again, rare, but possibility. In this case, person can develop psychosis or psychiatric symptoms, and again, it's a medical emergency. We have to take this patient to the emergency room, and they will run certain kinds of tests. They will check their titers, and they will rule out whether this is some form of an autoimmune response. Fourthly, there's a possibility it could be side effects from the medications. Maybe it could be side effect from the chemo or some other medications that people are treated for. Sometimes people in cancers are given opioids, which is the painkillers, and sometimes these opioids can cause some form of mental status changes, which can range from increased anxiety, mood instability, to even paranoia if the dosing is high. If that's the case, again, only a specialist can determine that, and then they can adjust the medication, change the medication, decrease the dosage, and do whatever else needs to be done in order to help this patient to return back to their baseline. Lastly, and most importantly, as I mentioned, cancer is a huge stress. It's a huge stress on the body. There is, as I said, stigma associated with the cancer, and there's also a fear of death associated with cancer. Many people, in fact, about more than 40 to 50% of people diagnosed with cancer can develop an episode of anxiety and depression. And sometimes depression can be so severe that a person can become psychotic, which is characterized by increased paranoia and, in rare cases, hallucinations. If that's the case, for that, again, an oncologist needs to first of all rule out all medical causes. And if they think that there is no other issue, there are no brain mets, there is no autoimmune condition, there is no steroid-induced psychosis, there is no side effects from the medication, and they talk to this patient, they talk to the family, in that case, an oncologist or whoever is the doctor in charge of this female will refer them to a psychiatrist. Now, this listener was asking, and in fact she had requested if there was any psychologist that we can refer them to. And again, it's important that this is one of those conditions, although I'm just such a big fan of therapy and I believe in therapy, but this is one such condition where you definitely do not want to begin with a therapist, a counselor, or a psychologist. This is most likely an organic cause, and this needs to be addressed, first of all, through an oncologist, possibly a neurologist, or whoever is the family doctor. I highly encourage you to reach out to the doctor who is in charge of this female as opposed to finding psychiatric care, because you have to rule out all other organic causes, because it seems like, from what I understood, is that this female was perfectly fine before her diagnosis, and this is sudden, and so this is an acute mental status changes. In fact, this person should be most likely taken to the emergency room, and if not, but definitely give a call to their doctor. There have to be, all the testings have to be done. Most likely a brain MRI will be done. As I said, the titers will be done, blood tests will be done, medications will be checked. And after that, if everything is ruled out, then a psychiatrist will evaluate and will possibly give a diagnosis, whether it's a delirium, whether it's a mood disorder, whether it's depression, whether it's anxiety, whether it's acute stress, whatever it is, they most likely will try some medication, and definitely from what you're describing, if I was the psychiatrist, I would prescribe a low-dose antipsychotic to this female so that her psychosis and paranoia can decrease, and then start her on what's called a low-dose antidepressant to decrease the anxiety. Again, it's only a professional who can see her. Only a professional can prescribe these medications. Please do not, and I highly lay stress on this, refrain from using any medications on your own. Refrain from running to a nearby pharmacist and say, hey, I watched this video, the doctor said I'm going to put her on this medicine, can I have a little bit? Please do not do this. This is one of those conditions where it's extremely critical, extremely important that this woman gets an emergent care, because it's a highly treatable condition. However, if we use wrong measures like going to the counselor's office thinking that this is a family issue, then we're just going to prolong this condition, and it's going to be extremely detrimental and harmful to this female. Remember, I think this woman has to get help, but it's also important that the family gets help. The woman you're describing has small children, so those children must be feeling very confused as to what happened. They must already be worried and anxious about their mom having this diagnosis. So it's important that that the family connect with each other, provide support to each other. Sometimes a family therapy could also be very beneficial to just give children that safe space where they can share their feelings. It's important that the adults in the family provide love and care to the children and use play and very easy to understand language, to educate them about what mom's going through and that this is a temporary condition, and to reassure them and validate their feelings and say, hey, mom's going to be okay, and try to create as much of a normal atmosphere in the family. I know in certain cultures, when somebody gets diagnosed with a condition like cancer, there's outpouring of relatives, and that's all for good, and it's all for good support. But sometimes when there's too much of an engagement, children get neglected, and children go like, what's going on? Is mom going to die? So it's very important to provide, use this opportunity for the children to make them a part of this process, have them spend time with their mom, give them little age-appropriate updates on how mom is doing and how she's going to be okay, create some one-on-one family time, like maybe just the husband, the wife, or who is this patient, just the kids, all of them can sit together and watch a TV show, read stories, listen to some music, or, pray together so that they can maintain that good connection and provide that safety to the little ones. And I hope you found this video helpful. I wish your relative all the best, and I hope she recovers and comes back to her baseline. Thank you for sending me this question. Don't forget to subscribe to this channel, and also please follow me on the social media handles. Take care. Bye.